Thank you, Presiding Officer. Michael Matheson ran up an £11,000 bill on his iPad and claimed the costs from the taxpayer. It was over the Christmas break, and £7,300 of that bill covered a single day, which was a public holiday. To put that into context, to run up those charges, he would have needed to have sent 8,000 emails in that one day. That's an email written and sent every 10 seconds continuously for 24 hours. All this while the Health Secretary was in Morocco on holiday. Does the First Minister really believe that Michael Matheson ran up all these costs on parliamentary business? Yes or no?
First Minister.
Presiding Officer, there is clearly more to say on this issue, and that's why Michael Matheson has agreed to make, with the agreement of Parliament, to make a personal statement later today. I have no intention of preempting that statement. He will lay out in full detail what has happened in relation to the use of his iPad. He has, of course, Michael has agreed to pay back the full amount. He has admitted to an honest mistake that has been made, and of course he will elaborate on that and certainly reflect on that.
Let us hear the First Minister.
Officer, I do understand in our politics the very first place we all go to is to think the very worst of each other. And, Presiding Officer, I hold my hands up. I've often done that myself and been guilty of it too. But honest mistakes do happen. Michael has been a member of this Parliament since its inception. All of us who have worked with him know that he is a man of honesty and indeed of integrity. So instead of rushing to besmirch each other's character, perhaps our politics would be a little better if we gave each other the benefit of the doubt. Michael will lay out in full what has happened in relation to his iPad, and of course the central point being he has already agreed, and I think he has already in fact paid back the full amount incurred on this expense.
Douglas Ross.
Humza Yousaf said it was an honest mistake. He's 50% right with that. And he also said he has no intention of getting into this. Well, I have no intention of letting the First Minister off with that argument. Because this goes to the heart of his government and his actions, and also the impact this is having on people across Scotland. Because this morning it emerged that Michael Matheson had cancelled a government visit to a Glasgow GP surgery. The Health Secretary has stopped doing his job because of this. So this really matters when Scotland's NHS is in crisis and we're approaching winter. It matters if there was an attempt to dupe taxpayers out of £11,000. For nearly a year, Michael Matheson was happy for the taxpayer to pick up this bill. He made no attempt to repay it until he was caught. His story is farcical beyond belief. So I'm going to repeat my question to the First Minister. Can he guarantee that Michael Matheson ran up all of these costs on parliamentary business, yes or no?
First Minister.
Again, Michael Matheson will lay out in full detail what has happened. And Michael Matheson has already said, of course, last week...
First Minister. When a question has been put to the First Minister, I'm sure we all want to hear the response. We cannot hear the response when people are shouting from seats. First Minister.
The response is there is clearly more to it. Douglas Ross is absolutely right. What I won't do is preempt the personal statement that Michael Matheson has agreed with the Presiding Officer to make later this afternoon. He will lay out in full detail what has happened, but importantly, of course, when that mistake was not just made, when, of course, Michael Matheson was made aware of that mistake, he took corrective action. That corrective action was, of course, to repay the full amount. Where I disagree entirely with Douglas Ross is that Michael Matheson has been doing anything other than concentrating on the job at hand. That's why he was able to announce, and we were able to announce this morning, of course, that we've secured the future of community links workers' posts in Glasgow with an additional investment of £1.2 million. On top of that, Presiding Officer, of course, this is the Health Secretary that ensured that Scotland was the country where there was not junior doctor strikes. On top of that, this is the Health Secretary who secured annual funding of £100 million to help to reduce waiting lists. So Michael Matheson is absolutely concentrating on the job at hand, but of course he will lay out in full later this afternoon the full detail of what has happened in relation to his parliamentary iPad.
Douglas Ross.
The Health Secretary is not doing his job. We know he refused to comment on shocking A&E waiting times this week because he was worried about the questions over his personal conduct. So yes, we need to hear from the Health Secretary, but this now goes beyond his actions. The First Minister has put his own personal reputation on the line. When this story broke, Humza Yousaf said the £11,000 bill was a legitimate expense. He said the money didn't need to be repaid to the taxpayer. He called Michael Matheson a person of integrity and character. He said, and I quote, "I absolutely take Michael at his word." He gave him his 100% backing. The First Minister is claiming Michael Matheson's word is more important than the facts. But Humza Yousaf's integrity is at stake here. So a direct question to the First Minister that he can't just put on the statement this afternoon. Does the First Minister still believe, as he did last week, even now with all the evidence, that this £11,000 bill was a legitimate expense?
First Minister.
Well, first of all, Presiding Officer, to get a lecture on principles and integrity from the party that gave us Boris Johnson is quite something. In the week when Douglas Ross's party, their flagship policy in Rwanda, was torn to pieces by the Supreme Court, hardly a party to be lecturing anybody on principles and integrity.
First Minister, it's absolutely impossible to hear any question or response being put at the moment because there is far too much noise coming from members, and I will ask you to desist. First Minister.
As I said, Presiding Officer, it is clear that there is more that has been discovered in relation to the iPad and the expense. Michael Matheson will make that clear in a statement later on this afternoon. And of course, I do have absolute confidence in Michael Matheson as the Cabinet Secretary for Health. And let me tell you why. Because on top of ensuring that we resolve the issue around community links workers posts in Glasgow, on top of ensuring that we resolve the junior doctor strike.
First Minister, I'm going to ask you, Mr Hoy, to make sure that that is the last remark that I hear when you are not on your feet and you haven't been called to speak. First Minister.
Well, they don't want to hear it because, of course, it goes contrary to their claims, because Michael Matheson is also the Health Secretary that announced £15.6 million additional funding for hospital at home this year to deal with winter pressures. He's the Health Secretary that announced £50 million for funding for the Scottish Ambulance Service. That is a Health Secretary that is entirely focused on ensuring that NHS recovers through the course of what will be one of the most difficult winters. And as I say, Presiding Officer, Michael Matheson, upon discovering what is an honest mistake, of course paid back the expense in its entirety.
Douglas Ross.
It wasn't upon discovering something. He claimed this. He claimed £11,000 from the taxpayer. And all I have asked from Humza Yousaf is, does he still agree, as he did last week, this was a legitimate expense, yes or no? And does he agree that that £11,000, that costs were ran up purely on parliamentary business, yes or no? I've tried that 3 times, and 3 times I have not had an answer. And the fact is, the First Minister should have immediately launched an investigation into this matter. He should have demanded that Michael Matheson hand over the device to be examined. Instead, he's the last person in Scotland still believing his Health Secretary's ridiculous claim. Now, if this story changes to be about family or personal usage, that still won't cut it, because it will be nearly a year after the claim and a week into this scandal. The evidence shows that Michael Matheson claimed £11,000 of taxpayers' money when he knew it wasn't for parliamentary work. It wasn't just a mistake. It was dishonest. So will Humza Yousaf do the right thing and sack Michael Matheson, or wait for his resignation?
First Minister.
As I have already demonstrated in my responses to Douglas Ross, Michael Matheson has been concentrating on ensuring that our NHS recovers through the course of what will be one of the most challenging winters it has faced. That's evidenced by the fact that I know over the last few weeks He's been working diligently to ensure that we are able to fund community links workers' posts in Glasgow. And I'm pleased we've been able to get to a resolution on that very matter. This, of course, is a matter between Michael Matheson as an MSP and indeed the parliamentary authorities. And, of course, the Parliament have made it clear that they have investigated the matter. But I have actually answered Douglas Ross's question.
Mr Ross, excuse me, First Minister. The First Minister is answering questions. Mr Ross, you have had an opportunity to put questions to the First Minister. It's extremely important that we carry out our business in an orderly fashion and show one another courtesy and respect. First Minister.
Presiding Officer, I have answered, of course, Douglas Ross's question, which is that there is clearly more that has come to light, which Michael Matheson will make clear in just a couple of hours' time. That is why he took the decision to repay back the full amount of this expense. So he will lay that out. Michael Matheson will lay that out later this afternoon. What Michael Matheson will then continue to do, of course, is what he has been doing for weeks, for months now, which is ensuring that our NHS gets all the support it needs during one of the most difficult periods in its history.